So lately, Kaplan has changed his tune. He's now calling MSCs medicinal signaling cells. And that's to his advantage because he's gotten very famous by inventing the MSC. And so he doesn't have to change the letters. He can just change the term and still be the father of the MSC, right? So the reason he's changed his term here is because they're starting to figure out how these perivascular cells work. They're basically emergency repair cells. So the cut to the steak knife rips those capillaries open. These cells essentially jettison from the edge of the bone, or the edge of the vessel, and turn into signaling cells, which wake up the other cells that are around the blood vessel to start healing, which is just being figured out, like in the last couple years. So this is not my slide. This is Dr. Kaplan's slide, but this is actually pretty important. I hope you guys can see it. Do we need to turn the lights off to look at this? Because I just want to. This is probably the most important slide because this is new. I mean, this is the last couple years they've figured this out. So you have an injury here, and so the injury damages the blood vessel in some way. The blood vessel has one of these medicinal signaling cells sitting on the surface of it, like you just saw. It basically lets go and turns into a true MSC. Then it gets activated because there's a whole bunch of inflammatory factors and other growth factors that come to the area from the opening in the blood vessel, right? So it's bleeding and not only blood is coming out, but there's also these other inflammatory cells that activate this MSC. And that turns it into a regenerative MSC. And so these little steps seem very simple, but it's actually incredibly complicated. If you take the cell and you open and you blow it up and you look at what kind of growth factors and what things are happening around the cell, you can essentially categorize it from left to right, right? So on the left side of the cell is the side that's facing the opening in the blood vessel. So as the blood vessel got torn in half, all kinds of there's all kinds of an immunologic response, right? So there's T cells and B cells and other reactive white blood cells that are going to come out of the circulatory system and start making sure that there's nothing foreign in the body. They want to kill bacteria. They want to isolate and remove any foreign stuff. Well, this MSC that just got activated could be seen as foreign, right? It's like if I give one of you guys my liver, your whole body is going to see that as foreign, and you have to have anti-rejection drugs given to you for a liver transplant. Well, this stem cell that leaves the blood vessel has all kinds of anti-rejection proteins and drugs that basically tamp down the immune system, which is pretty cool because what that means is that if I take stem cells from an umbilical cord, for example, and I inject all of those cells into everyone in this room, none of you will get a rejection response or an immune response. If I take my liver and I chop it up and I give it to everybody in this room, all of you will have a rejection response to my liver. So these cells are immunomodulatory, which means that they shut down any sort of reaction to show the body that it's not foreign. But here's the good stuff, right? The other side of the cell on the right side, so this is the side facing away from the vessel, has all these trophic factors. So it's anti-apoptotic, which means it keeps cells from killing themselves. It's anti-scarring, right? We've never had anything in the world of surgery that's anti-scarring. And all of a sudden this stuff is anti-scarring. And that's important to Jenna. We injected her knee with platelets to try to help with the scarring as well as cartilage damage. And the property of a cell to have some anti-scarring effects is incredibly cool. There's also mitotic factors which cause cells to reproduce. So what you need is fat cells to make more fat to heal, muscle cells to make new muscle to heal the muscle injury, cartilage cells to make new cartilage, right? So increasing mitotic function in local cells basically makes cartilage cells that are asleep build new cartilage. So I don't mean to belabor this slide, but this is brand new. This is Arnie Kaplan sort of changing his whole philosophy saying these are signaling cells, these affect the cells that are in the local environment. They're not mesenchymal stem cells that go down that line of differentiation that I showed you before. And they activate and function in the presence of localized injury, as well as the body's need for overall regeneration. And again, not to drone on, but if I were able to show you this video, he starts the video by talking about how there's 3 million red blood cells that turn over, die, and get excreted from your body every 30 seconds, right? So in the course of this lecture, if you guys didn't have stem cells in your body that are making new red blood cells, we'd all be dead by the end of the talk. Because what happens is that your body is constantly regenerating red blood cells. And we have a system to do that. So why can't we capture that and use that regenerative power, especially of these little guys that live on the surface of the blood vessel, in order to heal damaged tissue? So this is what's on the market right now in order to use your own fat, which we talked about, has a lot of stem cells in it, to heal whatever, orthopedic injury of some sort. So LipoGems is the brand name. I have a little problem with LipoGems. I tried it on about 10 patients or so, didn't work on any of them. What I did to these poor folks was lay them on the table and use a little liposuction cannula, and I sucked fat out of their love handles just under local anesthesia. A couple guys bruised up quite a bit and were pretty sore from the liposuction, but we didn't take them to the operating room and do it from the thighs and the butt and the underarm and stuff like that. It was just a local liposuction procedure that comes with the kit. Then once we had their fat, we literally, micronized the tissue, and I'm going to show you that in a second. But the important part of that is that the FDA cleared this for orthopedic applications. And we're going to discuss the FDA position on this in a minute. But the problem I have with this is that it doesn't generate that stromal vascular fraction that I told you about. It's basically just micronized fat, right? Which is not at all how this is being marketed, right? This is being marketed as a stem cell treatment. It's not. It's micronized fat that's getting injected back into people. And I'm going to tell you why that is for a second. But the data on whether this helps is pending. So even on the LipoGems website, it says LipoGems is not a stem cell therapy, right? This is if you go to the website. Everybody in the world thinks that LipoGems is a stem cell therapy, including the doctors that use it, right? So this is the whole marketing thing that I don't understand. Like, I own my own business and I suck at marketing because I don't know how the world can get away with this, right? And there's only a few people that actually drill down on it and figure out what it is, including doctors like me who are like, oh, everybody wants to give me some fat. Let's suck it out, mush it up a little bit, and put it back in people. And it's really just micronized fat. The thing that put me over the edge after doing a few of these is the way that you micronize the fat is you take it and you put it in a canister that has 3 big ball bearings in it. I don't know if you've ever seen it. And you shake it. And you shake it like the shake weight. So Chuck's doing exactly what you do to pulverize this fat as saline is washing it, right? So the saline comes in one end of it and comes out the other end of it. And it's washed fat that gets pulverized in this thing. And literally my staff is in the back like shaking these things. And I'm like, okay, right? They're charging patients, 10 grand for this. And this is a shake weight. Like, I can't keep doing it, right? So that's what we have going on. And so the reason that LipoGems is a company is making money is because they got FDA approval. And so historically, we've had no ability to use fat as a stem cell treatment until this company. And so this is Kaplan's position on what the FDA is doing. He's probably right. Like, stem cells shouldn't be regulated as a drug. And that has huge implications for what can hit the market. These two terms, minimal manipulation and homologous use, are what keep us from doing and broadening our ability to provide stem cells. So minimal manipulation means that you can't add any chemicals or otherwise manipulate this tissue outside the body. If you do, it requires a 510(k) approval from the FDA. So with the LipoGems company, they said there's no manipulation of the cells. We don't add any chemicals to it. We don't do anything except put it in the shake weight thing. And that doesn't qualify as minimal manipulation, and the FDA agreed. The other quality that it has to have, it has to be homologous use, which means that if you take fat out, whatever function fat has in your body, you have to put it back in that same function, right? So you can't take fat out and squirt it in your eyeball to help you get better vision, because fat doesn't function to give you better vision. So the way LipoGems got around that is they said fat is a cushion. So if you sit on your butt and you have fat in your butt, it cushions you. So we're going to put a cushion in the knee joint, and it's going to cushion the knee, right? Which is BS, right? So somehow they got the FDA to approve it, but what they can't do is they can't add collagenase to the fat, which releases the cells from the blood vessels, which gives you the stromal vascular fraction, which is the basis for all of the science that says that fat has stem cells that work. So all 10 of the people that I did, I probably didn't extract any stem cells from the shake weight. I probably injected micronized fat back into their knee, and none of them got better. So we bailed. But I'm not the only surgeon in the world. LipoGems is gloriously successful. It's not covered by insurance. People are selling it as stem cell treatment, charging patients somewhere between 5 and 10 grand for shake weight treatment of their fat. And the worst thing is that you don't look any better after the liposuction, right? It's not like, it's not any better. So I bailed on that. And unless the FDA changes and lets us get a stromal vascular fraction out of some fat, then I'm not going back until they show me that we can do that, right? And that's going to be a government thing that might come around someday. So next thing, bone marrow aspirate. We talked about this a little bit. This is pushed a lot more by industry than by science. Arthrex is a big company. You guys probably heard of Arthrex, I'm sure. It's a big company in sports medicine. They have the Angel system, which I'm going to show you in a minute. The problem with bone marrow that is now just coming to light is that your bone marrow stem cells are as old as you are. And so with time, the number of stem cells decreases. The viability of those stem cells in bone marrow decreases, right? So they're kind of old like we are. And so the best time to get stem cells out of your bone marrow would be about 10 years old. Right? And we don't have a lot of osteoarthritic 10-year-olds. So it's difficult to extract that bone marrow and purify the stem cells. The Angel system is, again, a genius marketing ploy. This is essentially a centrifuge with 3 colored lights that shoot through the test tube. By the light absorption patterns, you can get a graph, and it'll tell you what's in the fluid. So you can see how many red cells are in there, how many white cells are in there, and how many stem cells are in there, right? So this is the total nucleated cell count in thousands per microliter. And so if you take bone marrow, it turns out that, let me get my little thing there, this side of the graph is the amount of nucleated cells that you get out of a quantity of bone marrow. And depending on the age of the patient, those little bars get smaller and smaller the older you get. Turns out that it is a super low amount compared to how many hematopoietic stem cells you get, how much fat you have in your hip aspirate, and how much blood there is. So people will pull out blood, and they say you need to get 60 cc's. When this is a syringe full of blood, that needle's going into your iliac crest. And you can see that looks like blood.